Hi everybody. Today we are answering the question, why do family caregivers feel dismissed and ignored by healthcare providers? Many caregivers feel frustrated and even irritated because they are trying to get care for a loved one and they struggle. So learn why communication gaps and trust gaps exist in the healthcare system, and learn 5 things that you can do to work through these issues and get the care that you need for yourself or for an elderly parent. I'm Pamela D Wilson. My website is PamelaDWilson.com. On there, a lot of hope, help, support, articles, podcasts, videos, online courses for caregivers and aging adults. Please press the share button on this video. Share it with other people that you know who are looking for hope, help, and support related to caregiving and aging. And follow my YouTube channel. There are hundreds of videos here answering questions caregivers ask. So let's start with terminology. Family caregivers, who the healthcare system likes to call informal caregivers, because you do this out of love. You're not paid for it. You're not considered a paid caregiver. And so the problem is there's a lot of terminology that the healthcare system uses that caregivers and patients and people like us don't understand unless we work in the healthcare system, and even sometimes if we do, we don't understand the terminology. So if you haven't run into this yet, there are words used by healthcare providers, doctors, hospitals, the government, that doesn't make sense to caregivers and patients and consumers. And so this is the area where the first gap occurs, because a doctor may say, well, you need a SNF, and you're like, well, what the heck is that? And you don't want to ask because you don't want to seem like, I don't know what the doctor's talking about. I'm just going to kind of let this go over my head, and then something happens. So let me give you some examples of terms that you may have heard from medicals, payers, insurance companies, providers, all those people. They speak this foreign language. So EMR, electronic medical record, POC, plan of care, ADLs, IADLs, IPPS, LTC, CMS, Centers for Medicare, Medicaid, VBP, CAH, PPS, IQR, HIE, FHIR, CNA, Certified Nursing Assistant, SNF, Skilled Nursing Facility, all these. So one might wonder, is the healthcare system trying to make it more difficult for caregivers, consumers, patients? Are they trying to make the rest of us look uneducated and want to pull out our hair because we don't know what they're talking about? Well, if so, they're doing a great job. And so we're going to put up a little scorecard here. In this case, it would be healthcare system 1 and consumers 0, right? Next. Do healthcare providers attempt to exclude consumers by making everything just so confusing and overwhelming that you give up? How many of you have gone to the pharmacy and the pharmacist said, oh, your prescription's, not approved. I got to get some more approvals. Or you had a treatment that your loved one was supposed to get and it got denied, and you're trying to work with the insurance company. And eventually it gets all so complicated and frustrating because you're spending hours on the phone trying to get this stuff to go through, right? And then your loved one doesn't get the care they need. But guess who wins? Number 1, insurance company, because you give up. Consumer, 0, you gave up. But the problem is nobody really is winning, because the healthcare system is eventually going to have to pay more money to care for your parent who didn't get the care they needed in the first place. So we have to figure out how to work all of this out. Now let's talk about health insurance and health insurance plans, which if you have one, you should use it. But again, do you know what services or care your health insurance pays for? Do you know what your co-pays are, whether you go to a doctor appointment or your co-pay for a prescription? There's so much paperwork involved in all of this, and it's important to take the time to read it and understand it. It's important to call your health insurance company and ask them questions, because healthcare transparency is important. And even though there is a movement out there to make healthcare costs more transparent. We're not quite there yet. So the people who are winning, healthcare consumers, zero. So last, let's talk about the government and politicians and all the stuff that you hear in the news. It would help if consumers had a college degree or a PhD to even understand what they're talking about. And sometimes, honestly, I'm not sure even the politicians know. But here's the thing to think about. There are lobbying organizations, healthcare, hospitals, insurance companies, the pharmacy lobby. They make all your prescriptions, they make the vaccinations, and social media. These people spend a lot of money trying to influence the government and politicians and other people to do what they want. But the question is, who does all of this benefit? Does it benefit the consumer, or does it benefit all of those companies? I have no opinion. I will let you figure it out. If you're interested, search more and look more into lobbying and how that works and who spends the most money on the healthcare lobby. But right now, I will say that I will give a number 1 to them and a 0 to consumers and patients. So keeping all of this in mind, is it any wonder why patients, caregivers, consumers feel disadvantaged? Now, again, going back to the news and the literature and the things that you hear, most of that talks about disadvantaged populations and healthcare disparities. So basically, they're telling us who we are and how we should feel. I think that we should decide who we are and how we want to feel based on our feelings and our knowledge. Okay? So are they trying to make us feel bad about our lives? Are they trying to tell us who or how we should feel? So if you haven't heard of healthcare disparities, what it means is it's gaps, it's inconsistencies, it's inequalities, it's differences in healthcare provided to consumers. And research confirms that it's more significant with non-primary English-speaking populations, with women, with older adults, and people with disabilities. Now, if you are a caregiver, you don't need research to tell you this, because more than likely you are struggling to get care if you're a female. If you have older parents, you're struggling to get care for them. If you have disabled family members, you're struggling to get care for them. We experience the struggles, and we've been experiencing them for years. So we could tell the healthcare system a lot if they'd ask. But the question is, do they really want to know, and would they do anything? Great question. Caregivers and patients have to be more vocal and have to advocate and express concerns. Now, many caregivers say, Pamela, I'm afraid to complain to the nursing home or to the insurance company or to the hospital staff, because if I do, they're going to see me as difficult, which they do, right? Because there's a term called difficult patients, difficult clients, non-compliant patients, non-compliant clients. Healthcare has all these terms, and it's almost like we're battling like this, and we really shouldn't be. Instead, we should be working together. So rather than caregivers feeling intimidated and discriminated and being afraid of speaking up for yourself, we all have to start doing this. If you watch my videos, you know that I always promote both sides of the story, right? Because even though caregivers feel ignored and intimidated by the healthcare system also over here has a lot of rules and regulations that they have to go by. So the question is, how do we put all of this together? So let me just talk about something that you probably experience, right? You go to a doctor appointment, you're rushed in and you're rushed out, and by the time you walk out the door, you're like, man, I didn't even get my questions answered, right? Well, doctors have limitations on how many patients they have to see every day. The insurance companies limit what they have to do. They need a diagnosis code for everything. So kind of going back to trying to get prescriptions approved or treatments approved. If they're coding or billing people don't know what they're doing and they enter the wrong diagnosis code or a wrong code for something else, that's where the problem starts. Doctors who got into this business, right? They wanted to take care of people. They didn't realize that they were going to be business people having to deal with insurance companies and government regulations and all of this. Honestly, some of them spend more time doing paperwork and trying to get treatments approved than they spend with patients. And that really isn't what they signed up for. But after putting all of that time and effort into medical school, are they really going to leave and do something else? So in a sense, doctors and other providers are kind of held hostage by the system or the career that they chose. Burned out caregivers, on the other hand, okay, you're trying to negotiate all this. Maybe you want to get a loved one into a nursing home because you know that mom or dad need more care than you provide, but you look at the nursing homes and you're like, man, these places, they're understaffed, they smell, they put people in wheelchairs and sit them by the nurse's station. I don't want this kind of quality of life for my loved ones. These are valid concerns on both sides, yet, again, nursing homes have staffing issues. They have regulation issues. So I wish it was a perfect world. It is not a perfect world when it comes to healthcare. So how do you get ahead of all of this? 1, 2, 3, 4, 5. I'm going to share 5 things. But first, you have to get it in your mind up here that you have to take control. So how do you do that? Unless you have legal authority to talk to doctors and request medical information and look at records, by having a medical power of attorney document and a financial power of attorney document, which everybody should have, what do? There's a thing called a HIPAA form, Health Insurance Privacy and Portability Act. It's a form that your doctor's office, the hospital, or nursing home has to have your parent, or the person who needs care, give written permission to allow you to access their records and everything. Now, it doesn't give you access to speak up for them, because for that you need that legal document. You need the medical or financial power of attorney or a healthcare proxy. You need something, right? But at least it's a start to get you in the door so that you can attend medical appointments and ask questions and provide information. Now, the thing you have to know is you're not the patient, so the doctor is going to look to your parent or the person who needs care. You're kind of on the sidelines, so that's where you got to be the squeaky wheel, the mama bear, the pit bull. You got to do this, and you got to put a point on your scorecard, okay? Number 2, if you don't have a regular doctor, you don't have health insurance, get it and use it to your advantage. Learn how to schedule regular doctor appointments, get preventative care, what you qualify for. All this is available to you, so don't be afraid to use it. Score another point. Number 3, if you belong to a community health center or a health system that has an online portal, know that this can connect you with other healthcare providers and community services that could be hugely of benefit to you. But honestly, most people don't sign up. They don't know what the portal can do. They don't know what giving consent means. So take the time to learn about this and say, why would I want to sign up for this? What are the benefits to me? What am I going to get out of this, right? Now, even though you may have to sign that consent form, it puts you in control, because you then can contact doctors. You then can say, hey, I think I need this service over here. How do I get a referral? You reverse the power struggle and make the healthcare system work for you rather than you being controlled by the healthcare system. Score another point. Number 4, question everything. Busy doctors are going to give you the standard recommendations that they give to everybody. Lose weight, eat better, exercise, eat more fiber, cut out saturated fats, blah, 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 blah. Okay? But none of these may address your problem. You may have to go and make a medical appointment and a medical appointment and a medical appointment and a medical appointment to get the help you need to identify a certain condition. But be persistent and do it. Don't give up. Again, make the system work for you rather than the system saying, hey, do what 1,000 other people do. I don't want to pay attention to you. Again, talking for the doctors and the staff, they're rushed, they're under pressure, they want the easiest way out, refuse to be ignored or dismissed until you start saying, I'm already doing that. That doesn't work for mom or dad. This isn't working out. You're not going to get the attention you need. So again, speak up, advocate, be the squeaky wheel, mama bear, pit bull, and score another point. Number 5, and this kind of goes along the line of everything that we've been talking about. Stop allowing the healthcare system to control the care you receive and to refuse you from getting the care that you want. Now, there are formal ways to advocate and appeal decisions. And again, it's paperwork, it's time, I get it. But if you don't do it, everybody's going to continue to receive no's. So every state has a division of insurance. In Colorado here, it's called DORA, Division of Regulatory Agencies. But there is a complaint form in there where if you have an insurance company that's denying you care, you can go online and enter all the background, enter all the information, and someone at that Division of Regulatory Agencies Insurance Division will help you. There's also another portal called the Department of Health. Department of Health has places where you can complain about hospital care, nursing home care, in-home care agencies, because most of them are licensed, right? But you got to go on the portal and you got to complain to get the process started. And it can take time. I mean, honestly, I will tell you, a year ago, I had an insurance company refuse the copay for my flu shot, right? This happened on September 20th, a year ago. It took 6 months, but I finally got my copay back. And it was not really a matter of the fact that I wanted my $20.52. I wanted the insurance company to do the right thing and to do what was in my health insurance plan. So I know it sounds crazy, but I am an advocate for consumers and patients to get the care that you need from the healthcare system, to kind of flip the switch and put the control back in our hands. Because there is so much that consumers and patients and caregivers can do, but you have to know that you can do it. You have to have the confidence, have the self-esteem, have the skills to know what to do when somebody tells you, no, you can't have this treatment or that prescription, or we're ignoring your care, and just go do what 1,000 other people do. Don't be lumped into categories where you don't belong. Speak up, advocate, refuse to be intimidated. Find somebody to help you advocate if you can't do this yourself. How do you do this? You have to arm yourself with knowledge and education. On my website, PamelaDWilson.com, and here on my YouTube channel, there are plenty of videos, articles, blog posts. There's an extensive online program on my website, and it's free. All you have to do is go there and go through the sequences. There are, I think, 8 modules on everything from dealing with family difficulties, parents who refuse care. How do you make a care plan for someone with dementia? How do you manage care in hospitals and higher care agencies? And what do you say to the doctor? How do you get what you need out of a doctor appointment? It's all there. All you have to do is go to my website and find it and use it. I'm Pamela D Wilson. Thanks for hanging in there with me. I know this was a long video, but a lot of valuable information and helpful information for you. So please, again, press the share button, share this video, follow me on YouTube. Come back next week, next month. There will be more videos for you here, and have a fabulous day today. I'll see you all again soon in another video.